tendon is the short head, and this is the semitendinosus tendon. But in between these two tendon, the point to be known as a UB40 is located. Right, you just apply UB40 in this region. This also to be known as the center of the popliteal fossa. Now UB40 is the topmost distal point for the pain in the lateral side of the UB meridian, medial side of the UB meridian. If the pain is in this region, Taiyang meridian, and then is the Shaoyang meridian. But especially the Taiyang UB meridian having the pain, that time you can use the distal point to be known as a UB40. So this normally I recognize if we can advise to the patient attenders, whoever come for the treatment, they do have the back pain. In that time, ask them to give the pressure. So once they give the pressure, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Ask them to release. Again, let she also take the normal breath, and then further you just give the pressure with the thumb, with the knuckles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release. Further this to be repeated for at least 7 times. So in this way you can keep giving the pressure, have the positive impact. Definitely the back pain will get changes. Number 1. By the way, this is the grandmother point of the urinary bladder, and this is the first command point of the urinary bladder as well. So therefore, whenever there is a deficiency of the urinary bladder, chi is deficiency, and then blood also deficiency, and further the patient also having lot of acidity and gastric related issues as well. In that condition, definitely you can add up this point UB40 to treat for all the para orb of the uterus as well. So once it is the fallopian tube related issues or the ovarian related problem or anything uterus related or endometrium thickness conditions, all the conditions definitely that have the positive impact, which I told you UB1 to UB40 points. So this is the all the points are one side, but UB40 itself is the one side of the point, that indicating to treat for all the urinary bladder conditions definitely have the positive impact. So to treat by using the UB40 for the all the vesicle related conditions. By the way, this point you can use only the one needle, but don't use 1.5 tune needle deep, because beneath of that the popliteal artery is existing, but you cannot damage the popliteal artery. If the popliteal artery get damages, then in the peroneal artery there is a genicular artery is reaching downwards direction, that causes the problem. Hopefully we can apply the 1 tune needle deep, or we can give the pressure as well. When the patient having the posterior side of the knee pain, even that condition we can use it. By the way, there is the cyst normally will get. The whoever will come for the knee pain, try to touch and then palpate the back region, whether they do have some kind of the cyst on that region. That also reason to cause the problem of the pain on the posterior side. Then the cyst is there. That time you just take the candle and then do it as a fire needling. Then you just quickly insert the needle and then throw it off, insert the new needle and then take it out, and in that way we can do it around this region. That would be really better. But the posterior side of the knee pain patient have the indication, that time we can use the point to be known as a lower Hisi point for the urinary bladder, lower Hisi point for the triple warmer. So triple warmer you just apply here. There is 1 tune lateral to UB40, and inside of the biceps femoris tendon, this point to be known as a UB39 point is the lower Hisi point for the triple warmer, triple warmer. Now what is the mechanism of the triple warmer? Whatever there is a retention and accumulation that region, but that to be taken care for the transportation and transformation, even for the swelling of the edema of that region, that also to be useful by using this point. But by the way, having the more pain on the back region, then the foos is the most important point, which direction you need to apply. From this direction to this direction, better you give me 1.5 tune. So I just apply the needle from here 1 tune above from the UB39. Then from here you just apply towards the UB40. You just apply towards the UB40. we apply towards this, but indicating for the overall for the knee pain, posterior knee pain. Even you just activate 3 points, but obviously having the great impact, the pain is the hamstring muscle having the problem. The gastrocnemius muscles are the reason to cause the knee pain. That both the conditions we can use at this points. By the way, if this stiffness is there where the flexion of the knee is not possible, that time this hamstring muscle causing the problem, then you can use the local points from this region where the hamstring muscles motor points as well. But here also there is the short head motor point and then long head motor points of the hamstring muscle. Try to find out, you just give the pressure, patient feel, ouch, I have the pain, so that indicating that particular area, no acupuncture point, but that painful area you just activate and then stimulate the hamstring. What are the muscles? This is the biceps femoris muscles, and then for the semimembranosus and semitendinosus muscle, that having the strain, that can be treatable by activating these motor points as well. Now we are coming to the UB 40 and then UB 55. UB 55 point is 2 chun distal. Remember, 2 chun distal to the UB 40. Then we can use the point where exactly this the point. Definitely this will be the patient where unable to fold the leg. In that situation, you can use this point. Unable to stand for the longer intervals, even that situation also you can use this point as well. Then UB 55. Then 3 chun again further, 3 chun further distal to the UB 55. This point to be known as a UB 56. Please apply UB 56 point. Yes. This is as the belly of the gastrocnemius muscles. What are these muscles? This is as a belly, this is the GN muscles, these muscles. Then inside of the muscles, this is surface muscles to be known as a GN muscles. Inside of the muscles to be known as a soleus muscles, but these muscles to be known as the anterior tibialis muscles, but these muscles inside of the muscles to be known as the soleus muscles. Now you just come down from here, this is a 3 chun, then further it is the 3 chun. So I think this point is here. Yes, now again 3 chun, you just apply here this point to be known as a, this is as a he yang chang chin chang shang fi yang fu yang kundulun. Now you just apply UB 57. Then 58 point is 7 chun proximal. So you just make it slightly, you just do it. Yeah. Now we can turn this way. We try to find out the Kunlun. First we try to find out where the Kunlun point, then we find out this point as well. So where exactly there is a mountain, and this is as a 2 mountains over this region. Now try to understand this called as a lateral malleolus. What is lateral malleolus? End of the fibula. This bone to be known as a fibula. This fibula end to be known as a the lateral malleolus. So lateral malleolus, the tip of the lateral malleolus and then the tip of the Achilles tendon. Right. This is the lateral malleolus. Then this is the Achilles tendon. Midway between these two, the depression to be known as a UB 60. That is the Kunlun. You just apply UB 60. Good. So this is in fact is the great point UB 60. You know, it is the distal point for the cervical pain and then upper back pain. But this is the opposite reaction. UB 40, it connects to the stomach and then urinary bladder. But the UB 60 connects to the urinary bladder and then small intestine and then triple warmer. Because UB 60 is equal to the SI2, that is the Chiango and then Yemen. UB Sanjo 2. So they are interconnected each other. So therefore UB 60 is a great point to treat for the ear related problem, cervical related conditions, because this is the distal point for the neck region. The patient will get the vertigo, giddiness, fatigueness, lethargy, amnesia, numbness, tinnitus, ear related problem, deafness. The partially this will be helpful to treat for all the head and neck related disorders, because this particular point, it rushes the blood to the upper part of the head region. When there is the low energy, yin get excessiveness, yang get deficiency, that time this will be helpful to treat for the upper head related disorders. Now we are stepping into the UB UB59. UB59 again 3 chun proximal to this region is UB30, UB59. You just apply UB59. Good. This also soleus muscles. This is the sural nerve to be activated by using this point. Again, there is the again 4 chun plus is 1 chun. That means is the 5 plus 3, 8. But 7 chun proximal. 3 chun, 3, 6 plus 1 chun, 7 chun proximal to the UB60. That point to be known as a UB58 point. That is the Phi Yang point. You just apply this Phi Yang point. Yes. So UB 58, 59 and 60. How many points totally we completed here? Total 60 points were completed. Now we are stepping into the most, this also command point, this also command point. But these points are used to treat for the cramps on the muscles, that is the gastrocnemius muscle. Cramps can be treatable by activating this point. What are the calf muscles? This is the calf muscle, this also calf muscles, that to be known as the soleus muscles and also gastrocnemius muscles, collectively known as the calf muscles. Now we completed this procedure. I think you just take out this needle.